With regard to fascial stretch therapy, it does incorporate some components of PNF stretching, and then it also incorporates the 10 principles that I just mentioned a couple minutes ago, and it's going to use their unique stretching sequences that Anne and Frederick developed themselves. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I've got another book review for you guys, and today I'm going to be reviewing the book Fascial Stretch Therapy by Anne and Frederick of the Stretch to Win Institute. In my 18 years as a coach, this is easily one of the best 18 books that I have read, and if you are a manual therapist, a strength coach, a personal trainer, or if you are interested in taking the Fascial Stretch Therapy course and becoming a fascial stretch therapist, then I would highly encourage that you pick up Fascial Stretch Therapy. We're going to get into what is inside, but first, real quick, like the video and comment down in the comment section, as it would really help me out and help with the algorithm. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel, hit the notification bell so you don't miss out on any of the content. Now, we're going to take a look at what exactly is inside. One of the things that they are going to discuss in the Fascial Stretch Therapy book is the 10 fundamental principles of fascial stretch therapy. I'm not going to get into them into detail because I already did that in another review, my review of the Stretch to Win book. If you ended up missing that review, I'm going to include a link right up over here. But a few of the principles with regard to fascial stretch therapy, you want to make sure that you synchronize the breathing with the movement. You want to make sure that you're following a logical anatomical order. You want to make sure that you are eliciting a stretch without getting into pain. So you want to gain range without pain. You also want to make sure that you're targeting multiple planes of motion instead of just going in one direction. And you want to make sure that you are adjusting the stretch based off of each patient or client's goals. Another one of the things that they are going to discuss in this book right over here is they are going to compare and contrast various forms of stretching and different stretching techniques. 3 of the forms that are going to be covered in this book. One is going to be PNF stretching, or Proprioceptive Neuromuscular Facilitated Stretching, and I have an entire playlist dedicated to assisted PNF stretching if you guys are interested. It's right up over here. But PNF stretching, basically what you're going to do is you're going to stretch the muscle, you're going to have the patient or client contract the muscle, and then you're going to be able to stretch them and get deeper into the stretch. Then they're going to discuss fascial stretch therapy, which of course is the modality that they themselves created. With regard to fascial stretch therapy, it does incorporate some components of PNF stretching, and then it also incorporates the 10 principles that I just mentioned a couple minutes ago, and it's going to use their unique stretching sequences that Anne and Frederick developed themselves. And then the third type of stretching that is going to be discussed in this book is going to be active isolated stretching, and this is something that was created by Aaron Matties. And if you're not familiar with Aaron Matties, I'd highly recommend that you pick up his books too. These aren't going to be part of my 18 best books that I've read over the course of the last 18 years as a coach. However, active isolated stretching, stretching for everyone, and active isolated strengthening, these are by Aaron Matties, and I would highly encourage you to pick up those as well. But let's get back to the book right now. With regard to active isolated stretching, there are 5 different principles. Number 1, you want to identify the specific muscles that you need to stretch. Second thing you want to do is you want to isolate the muscles that you plan on stretching. The third thing is you are going to intensify the contractile effort of the agonist muscle. Number 4, you want to signal the agonist muscle to contract. And then the 5th principle is you want to inhibit the muscle by relaxing. Then, aside from that, in this book, they're going to get into different assessment techniques. And if you are interested in learning how to assess people, you can check out this playlist right up over here. But with regard to the assessment techniques, a couple of the ones that I want to discuss is the SITTT technique and the PMJN. With regard to the SITT, the S in SITT, the first one, it stands for scan. You want to be able to scan the suspected region where you suspect there may be a problem, and you want to use your dominant hand. Then the I stands for identify. You want to identify the fascial nets that are going to need the most attention and that are going to alleviate the symptoms of your patient or client. The third one, the T, that is going to stand for treat. You want to treat the area that the pain is, that you suspect where the problem is. Once you've treated it, then the other T stands for test. You want to test the area and see if your treatment ended up eliciting a positive result. And then if it did elicit a positive result, the 5th one, that's going to be T, and that is going to be treat. Treat again. So if you did perform a treatment, a small treatment, and you found that it elicited a positive result, then you want to treat that area again because you know that it actually works. And then the other thing that is discussed, the other assessment technique, is going to be the PMJN. PMJN, it is not only assessment technique, it is also a treatment strategy. What you want to do, the P stands for posture, the M stands for myofascia, the J stands for joint, and then the N stands for nerve. So in that order, you want to assess the posture, the myofascia, the joint, and the nerve, and then when you perform your treatment, you want to treat in that order. You want to do the posture first, then the myofascia, then the joint, and then you are going to treat any type of neurological issues that the patient or client has. Then With regard to the book, this is pretty much the meat and potatoes of the book, and it is going to be the lower body technique and the upper body technique. And if you are interested in learning a little bit about fascial stretch therapy, I have some time-lapse videos of some actual treatments. You can check it out in this playlist right up over here to give you an exact idea of what exactly is entailed in a fascial stretch therapy treatment. But what you're going to learn in this book is you're going to be brought through a general assessment to actually assess the patient and see what exactly they need. And then you're going to be taught this flow. The flow that is in this book, it is basically the level 1 course. You could consider this a level 1 fascial stretch therapy course manual. And with regard to the stretches, you're going to be taught a lower body stretching sequence and then an upper body stretching sequence. And then there's also going to be some additional stretches that you could learn as well. There's going to be some sitting techniques, some floor stretches, and also some standing stretches that you could perform with your clients and patients. And that's pretty much it in terms of the book. Really great book. I'd highly encourage you guys to pick this up, especially if you're planning on becoming a fascial stretch therapist. And then next week, I'm going to be reviewing another course from the Stretch to Win Institute, and it is going to be the LifeStretch course. So be out on the lookout for that next Thursday, 2 o'clock p.m. But if you guys have any questions, go ahead and ask your questions down in the comment section so I can help you guys out. And that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so I know to keep making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel, hit the notification bell, as I'm going to be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.